Welcome to my study. I am Sam the Man. I am an independent Medicare health broker in the state of Texas. I handle all the plans but do not work for an insurance company. Now, I got into this 8 years ago, and it's never ceased to amaze me how complicated and how hard to understand Medicare is. I mean, like, when you go to an accountant, you're not supposed to read all of the tax code. You get an accountant to just help you and do your taxes. In fact, you can even do a 1040 EZ. So that's what this is, Medicare EZ. And at this point, most of these guys say, hit the like button. I really don't care about that. I want you to understand about one of the most important government programs you'll ever have. That is important. So here we go. In the beginning was Lyndon Johnson, the last president who did something for the common man. We call him Landslide Lyndon down here in Texas. He created Original Medicare. Original Medicare has two parts. A for hospital and B for medical. So when you go in to the hospital, you have a $1,400 deductible, and I'm rounding everything out. I'm trying to keep it simple. And that gives you 2 months in the hospital. That's A. B is for your medical. You pay $144 a month to have it, and then you pay 20% of the doctor bill. That's Medicare. No drugs, no vision, no dental, nothing else. Oh, we don't have a picture of the Medicare there. Here is a picture of the Medicare card. It has A and B. You have to have A and B to get in the game. This right here is actually a picture of a Texas Medicaid card, which can be very helpful with your Medicare. This guy right here is my grandson, Sir William. That's when he was 1, and now he's 5. And he is all boy. Every time I see him, Pops, I'm 5. That's my grandson. Well, back to Medicare. So we've only got hospital and medical. We need to get some drugs. Well, here's Part D. That is your drug plan. It covers your drugs. They range anywhere from $15 to $25 to $45 a month. There's lots of choices. So now we've got our hospital, medical, and drugs. Well, how do we cover the holes, the 20% that you have to pay under Part B? There's 2 options. The first one is we supplement our Original Medicare. Our Medicare pays first, and then we buy private insurance, which is called Medigap or Medicare Supplemental Insurance. These come in several flavors, different plan numbers, G, F, N, and which one you pick determines how much of the cost and cost sharing will be covered. This is private insurance. It goes through your state insurance commissioner. It is like car insurance or homeowner's insurance. You can buy it and change as needed. There is no enrollment period. And just like car or homeowner's insurance, it will go up every year. So you might be a guy with a plan G, you're talking about $125 to $150 a month. The main thing about this is it's good anywhere in the United States of America with any doctor who takes Medicare. So basically, you're buying freedom. It does cost money, that will go up. But you can go to any doctor, anywhere in the country. No referral. You can go and choose here or there, whoever you want to go see. That is Original Medicare, the red, white, and blue, with the supplement. You show both cards. The second way to go is the Medicare Advantage. This is not a supplement. Please don't confuse them. A Medicare Advantage is a government contracted program. You're taking your original Medicare and you're moving it over here, and the insurance company is managing your Medicare. They have to cover the same things that Medicare says it's got to be covered, okay, but they get to change what you pay. So normally an Advantage plan is going to be $0 a month, okay? If you go to a specialist, you might have a copay of $30, $40. For different services, they're going to have copays, and these vary from plan to plan. So it's going to cover your hospital A, your medical B, and drugs are probably going to be with it too. So you're not paying extra to have drugs. You're not paying extra to have the Advantage. Most of them are zero monthly cost. Now, Advantage comes in flavors. An HMO is where you're going to a contracted group of doctors. If your doctor's not in that plan, you pay the whole bill. It also is bounded or limited in geography. So if you live in Hayes, Travis, Williamson County with one of these plans in my area, you will go to doctors in that area. If you go on over to San Antonio, you pay the whole bill. In fact, if you go outside the area, you have no coverage except for emergency. So an HMO does not travel very well. If you like to travel, you want to look at a PPO. A PPO gives you more freedom. You're still looking for doctors who are contracted, but you can travel with it. You can go on up to another state, and with a major insurance company, you're going to find doctors that are contracted in that area. PPO, a little bit higher copays, but there are some now where you pay $0 by the month. So that's the beauty of the Advantage. If you don't have any major things other than going to your primary doctor, you pay nothing. It is cheaper. And moreover, an Advantage will give you added benefits. So you might have some dental money or just dental cleaning, maybe some money for eyeglasses, rides to the doctor. Some have acupuncture, over-the-counter catalog items, little health items you'd normally buy. You can get that. These are the things that will help keep little things little. So for instance, all of them have the club membership or workout privilege, and you can go to a number of places in your area and go in no charge. They know if you're going to a primary, you don't have to pay for it, or if you're going to the health club, you're going to be healthier. And they get paid the same every month. So that's to their advantage. So again, the HMO or the PPO of an Advantage program is a lot cheaper, unless you're bad sick. It also gives you some added benefits and includes your drug coverage. So what's best? Well, I will tell you, there is no one right plan. Is your doctor in the plan? Okay. Is it giving you what you need? Maybe some dental work. So how does that compare to a supplement? A supplement costs money, and it will go up, just like your car insurance. It will cost money. But you can go to any doctor anywhere in the U.S. that accepts Medicare. So those are your two options. We have original with a drug plan and the supplement, or we have an Advantage, which includes everything all in one. Now the Advantage has certain times a year when you can enroll. That's not set in stone. There are exceptions to that. So don't think that you have to wait for October 15th. Here is a little bit about me. Again, I am an independent broker in the state of Texas. If you're outside of the state of Texas, I cannot help you. I'm not licensed there. I work by phone. I have a palsy in my right hand. I cannot type worth a hoot. So if you'd like my help, please call me. 512-971-7011, and I'll get back to you within a few hours. My role is to help people, not to sell. When I help people, they call me. I get other people calling, and then I'm wealthy as a benefit. I want to thank a few people for assisting me. The first one is Chainsaw Leon, who's filming this right now. He is a really good up-and-coming filmmaker in the city of Austin. Second is my sister, Randy Southern. She's the owner of Endra's Warehouse, which is a phenomenal art center. Next person is my daughter, Sedona. Single mom, 5-year-old boy, and she is a crackerjack real estate saleswoman. The last person is my grandson, Sir William. He has reminded me how important it is to play and have fun. Well, that's it. We'll have a few more videos on supplements, special need plans with Medicaid. Until then, I am Sam the Man. God bless you. Have a good day.